Welcome back to the Behavioral Buzz Blogcast. Today, we're going to be doing a deep dive into the world of preference assessments and ABA therapy. We're pulling all of our insights straight from behavioralbuzz.com. We often talk about the power of personalization in therapy and preference assessments. Those are really the foundation for building those individualized treatment plans.
Yeah. It's really fascinating how something, as seemingly simple as figuring out what someone enjoys can really have such a profound impact on their therapeutic journey.
Exactly. And it's not just about, whether a client prefers a toy car or a stuffed animal. It's about understanding what motivates them at a deeper level. And behavioralbuzz.com, they really highlight how this understanding is key to creating interventions that truly resonate.
Absolutely.
Yeah.
When we use those preferred items or activities as rewards, we're really tapping into a powerful source of motivation. It's like finding the key that unlocks a client's willingness to participate, to learn, and to make progress.
Okay, so let's unpack some of the benefits of conducting these assessments. Behavioralbuzz.com. They outline a few key advantages, things like enhanced motivation, personalized interventions, improved engagement, and data-driven decisions. Can you elaborate a little bit on how those advantages play out in real-world therapy?
Absolutely. So imagine you're working with a child who loves dinosaurs. You might assume that any dinosaur toy would be motivating, but through a preference assessment, you discover they're particularly fascinated by the T-Rex. Suddenly, you can incorporate that specific interest into their therapy sessions, using T-Rex facts, dinosaur toys as rewards, and even tailoring social stories with the dinosaur theme.
That's such a great example of personalization in action. So instead of just generic dinosaurs, we're honing in on what truly sparks their interest. And behavioralbuzz.com, they also emphasize how this data-driven approach helps us make informed decisions, right?
Precisely. Let's say you're working with a client who's nonverbal. A carefully conducted preference assessment might reveal that they consistently choose a specific sensory toy over others. And that seemingly simple observation provides valuable insight into their sensory needs. And it helps you tailor a sensory diet that is truly effective, rather than just guessing what might work.
So we're not just throwing things at the wall and seeing what sticks. We're using data to make targeted decisions that increase the likelihood of success.
And speaking of success, behavioralbuzz.com, they really emphasize how preference assessments can improve client engagement.
That's a crucial point. When you're using things the client enjoys, therapy becomes less of a chore and more of a fun, rewarding experience. It's about creating a positive feedback loop where engagement fosters progress, and progress further fuels their motivation.
All right, so let's get into the different types of preference assessments outlined on behavioralbuzz.com. They break it down into 4 main categories: single item presentation, paired choice, multiple stimuli with replacement, and multiple stimuli without replacement. And each approach has its strengths and is chosen based on the client's abilities and what we're hoping to learn from the assessment.
Okay, so starting with single item presentation, it seems pretty straightforward. You present one item at a time and observe the client's reaction. Behavioralbuzz.com even gives an example of an RBT presenting a toy car to a child and noting their level of interest.
Exactly. This method is particularly helpful for individuals who might find decision-making challenging by presenting one item at a time. You can gauge their level of interest without overwhelming them with choices.
Okay, now, building on that idea of gauging interest, let's explore paired choice. Behavioralbuzz.com describes this as presenting 2 items simultaneously, requiring the client to choose one. It's like a classic the this or that scenario.
Right, precisely. And as you repeat this process with different pairs, you can start to create a hierarchy of preferences. You'll see which items consistently rank higher, providing valuable insights into what truly motivates the client. They use a simple example, offering a child a choice between a cookie and a piece of fruit. But this concept can be applied to various categories of items or activities.
That makes sense. So we're not just identifying what they like.
Yeah.
We're understanding their relative preferences. And behavioralbuzz.com mentions that it's important to keep comparisons within similar categories, like edibles with edibles, toys with toys, and so on.
Absolutely. Comparing a toy car to a piece of candy. That wouldn't give us useful information about their preferences within a specific category.
Right. So we've covered single item presentation and paired choice now. Things get a bit more complex with multiple stimuli with replacement, or MSW. Here, you present multiple items. The client chooses one.
Chip.
And then you put that chosen item back into the mix for the next round.
It might seem counterintuitive at first, but the beauty of MSW is that it helps you identify those items that hold a consistent appeal. even when presented alongside other options. BehavioralBuzz.com. They use the example of a child choosing a toy car from a group of toys. The car gets returned to the group, and we see if it remains a top pick, even when other toys are available.
So it's like a popularity contest where the winner keeps getting a chance to win again.
Yeah.
And by observing those consistent choices, we're getting a clearer picture of their strongest preferences.
Exactly. It's about identifying those items that have lasting power in terms of their appeal.
Finally, we have multiple stimuli without replacement, or MSWO. This time, when an item is chosen, it's removed from the array, so each choice narrows down the field, eventually leading to a ranking of preferences.
This method is fantastic for establishing a clear hierarchy of preferences, from the most preferred to the least preferred. BehavioralBuzz.com provides a great illustration. A child choosing their favorite toy from a group, with each chosen toy then being removed. It's like a step-by-step revelation of their preferences.
So each choice they make reveals their next favorite item, and we end up with a comprehensive ranking of all the items presented.
Precisely. It's a systematic way to uncover those subtle differences in preference and create a clear picture of what motivates the client.
We've covered a lot of ground here, from the why behind preference assessments to the how of conducting them, all thanks to the insights from behavioralbuzz.com. I think it's clear that these assessments are far more than just figuring out what someone likes. They're a powerful tool for building truly personalized and effective interventions.
Absolutely, yeah. There is a lot of depth to this topic, and behavioralbuzz.com really dives into some of the common questions and nuances that come up when we talk about preference assessments.
I bet, and I'm sure our listeners have some questions of their own, so let's tackle some of those head on. For starters, with all these different types of assessments, is there a best one?
That's a question we get all the time. And the truth is, just like there's no one-size-fits-all approach to therapy, there's no single best preference assessment. The key is choosing the method that best suits the individual client and the specific information we're trying to gather.
Right, and behavioralbuzz.com echoes that sentiment. They highlight how each assessment type has its own strengths, making it crucial to select the right tool for the job. For instance, if we're working with a client who might struggle with making choices, a single item presentation could be a great starting point.
Exactly. It simplifies the process and allows us to observe their reactions to each item without overwhelming them with options. But if we're looking to establish a clear hierarchy of preferences, paired choice or multiple stimuli without replacement, or MSWO, might be better suited.
So it's about understanding the strengths and limitations of each approach and tailoring our assessment strategy accordingly. Now, another question that often pops up on behavioralbuzz.com is about single stimulus preference assessments. Can you shed some light on those?
Of course. So think of it as a more in-depth version of the single item presentation. You're still presenting one item at a time, but instead of just noting a simple yes or no for interest, you're observing and recording their reaction in greater detail.
So we're looking for more nuanced responses, like how long they engage with the item, the type of interaction they have, their facial expressions, so on. It's about painting a richer picture of their level of preference.
Exactly. This can be particularly helpful for clients who might have difficulty expressing their preferences verbally, or for whom a simple like or dislike doesn't capture the full picture.
Now let's talk about something behavioralbuzz.com is very clear about. The difference between preference assessments and reinforcement assessments. They make a very clear distinction. But I think it's worth unpacking for our listeners.
Absolutely. It's a crucial distinction. Think of it this way. Preference assessments help us identify what a client enjoys, their likes and dislikes. They give us a starting point, a list of potential motivators. Reinforcement assessments, on the other hand, take those potential motivators and test them to see if they actually increase the likelihood of a desired behavior.
So it's not enough to know that someone loves dinosaurs. We need to see if presenting a dinosaur toy actually makes them more likely to complete a puzzle or follow a direction.
Precisely. It's about confirming whether those preferred items or activities truly have the power to reinforce behavior. Preference assessments find the candidates. Reinforcement assessments determine if they make the cut.
It's like an audition for reinforcers. Preference assessments help us narrow down the field, and reinforcement assessments determine who gets the starring role in our intervention plan.
I love that analogy. It really captures the essence of this crucial difference.
Now, behavioralbuzz.com also dives into something called free operant preference assessments. What exactly do those entail?
It's a fascinating approach. So instead of presenting items one by one or in pairs, we give the client free access to a variety of items or activities in a designated space. It's like creating a buffet of potential reinforcers.
So we're not forcing choices
Yes. Yeah.
or limiting their options. We're simply observing what they gravitate towards in a less structured environment.
Precisely. We observe and record the duration and frequency of their interactions with each item, noting what captures their attention and holds their interest. BehavioralBuzz.com provides an example of an RBT placing several toys in a play area and allowing the child to choose freely.
It sounds like this approach gives us a glimpse into their natural inclinations, their intrinsic motivation. What are some of the advantages of using this type of assessment?
One of the biggest advantages is that it can be less demanding for the client, especially for those who might be overwhelmed by structured assessments. It also allows for a more naturalistic observation of their preferences, as they are free to explore and interact with items in a way that feels natural to them.
It's like we're peeking into their world and seeing what sparks their joy, without imposing limitations or expectations.
Exactly. And this information can be incredibly valuable when designing interventions that feel authentic and motivating for the client.
Speaking of motivation, I think it's becoming increasingly clear that preference assessments aren't just about finding things clients like. They're about understanding the why behind those preferences and using that knowledge to create truly individualized and effective interventions.
Absolutely. It's about seeing the world through their eyes, understanding what brings them joy, what sparks their interest, and what truly motivates them.
And BehavioralBuzz.com emphasizes that. By making therapy enjoyable, we increase the likelihood of success. When clients are having fun and feeling motivated, they're more likely to actively participate, learn, and make progress.
It's all about creating a positive and rewarding experience that fosters growth and empowers the client to reach their full potential.
So, we've explored various types of preference assessments and addressed some common questions, drawing insights from BehavioralBuzz.com. It seems like the key takeaway here is that these assessments are essential for building truly personalized and effective interventions.
I couldn't agree more. By taking the time to understand what motivates our clients, we can tailor therapy to their unique needs and preferences, making it a more engaging and rewarding experience for everyone involved.
Welcome back to the Behavioral Buzz Blogcast. We have been exploring the ins and outs of preference assessments in ABA therapy, all thanks to the wealth of information on BehavioralBuzz.com.
Yeah, it's been quite a journey. We've gone from, understanding that basic one of preference assessments to really delving into the why and the how, exploring different approaches and unpacking those nuanced details that make these assessments so powerful.
Absolutely, and I think our listeners have gained a solid understanding of how crucial these assessments are for building effective treatment plans. So, let's recap some key takeaways from our exploration of BehavioralBuzz.com.
All right. So we started by highlighting how preference assessments help us identify those items or activities that have the power to motivate our clients. We learned that there's no single best assessment method, and choosing the right approach depends on the individual client and what we hope to learn.
Right. We also talked about the importance of going beyond simply knowing what a client likes. BehavioralBuzz.com really emphasized understanding the why behind those preferences. So we can create interventions that genuinely resonate with the client.
That deeper understanding allows us to tailor therapy in a way that makes it more engaging, enjoyable, and ultimately more successful.
And remember that crucial distinction between preference assessments and reinforcement assessments. Preference assessments help us pinpoint potential motivators, but it's the reinforcement assessments that confirm whether those motivators actually have the power to influence behavior.
Right. It's a two-step process. We first identify what might be motivating, and then we put those potential reinforcers to the test. BehavioralBuzz.com provided some great examples of how that plays out in real-world therapy scenarios.
As we wrap up this deep dive into preference assessments, we want to leave you with a final, thought-provoking question to ponder. We know that preferences can change over time. What are some strategies that therapists can use to stay attuned to those evolving preferences? How can we ensure that our interventions remain engaging and motivating for clients, even as their interests and preferences shift?
That's an excellent question to consider.
And remember, BehavioralBuzz.com is a fantastic resource for all things ABA, including preference assessments. They have articles, study guides, practical tips, and even some cool ABA swag to show off your passion for the field. So head over to BehavioralBuzz.com to continue your learning journey.
Thanks for joining us on this deep dive. Until next time.